Hello, and we are live. We are live, all the way live. Welcome. I am Dr. Mo Anderson, founder of Drop the Drugs, a nonprofit in the Dallas-Fort Worth area. We are raising awareness about prescription pill and over-the-counter drug abuse, safe storage and disposal of drugs. And I'm so excited to be hosting our first Facebook Live webinar with my good friend and amazing gentleman, Dr. Brian Dixon. Welcome, Brian, Dr. Dixon.
Thank you so much for having me, Dr. Mo. I appreciate it.
And we've known each other a few years now. I know you as a psychiatrist, an entrepreneur, an author, and just man about town. But what I ask you to help me to do tonight is have a frank discussion about what's going on with, we're all just weary of it, the stay at home, the quarantine, the global pandemic. We've got an economic crisis. So I want to talk about a few things with you tonight. Let's talk about what is this feeling? What's normal? Is it depression, anxiety, grief? Especially, how do we notice signs in our loved ones? You know, they might be trying to hide how they're really feeling. Some of us are very expressive, but I want to talk about signs that we might see, subtle signs of anxiety in teens and children and our partners. I want to talk about self-medication. You know, that's what Drop the Drugs is all about, prescription and pill abuse. That is also an epidemic in America, with over 60,000 children a year going to the emergency room because of accidental poisoning. We'll get on that a little bit, and then end up, real positive with coping and some resources and strategies to get us, adjusted to our new normal, because things aren't going to be the same. We talked about this yesterday. There'll be a new normal, and we need to talk about what that looks like. So I want to start with just, what is this weariness that we're feeling, this heaviness? What's going on? What's a label for that, and why is it happening?
Yeah, one of the things about stress, so when you have a stressful event, and that could be anything, to me, it's anything that is unusual for you, and everybody's experience is different. So people who live up north, people who live down south, whether you're white, black, everybody's experience is a little bit different. But anytime we go through a stress, so a stressor, especially like this, where we don't see the end, it's just, we know that it's not normal. We know that it's not normal to just stay home all day. It's not normal to be asked to stay in your house. So anytime you have a stressor that has been stretched out for a really long time and you can't see the end, it's very unsettling. And so I really encourage folks to pay attention. So you were asking about warning signs of stress in ourselves or in our loved ones. Sometimes stress can be very somatic, meaning it's inside your body. So you'll have upset stomach, your stomach starts to hurt, you get indigestion really easily. Sometimes it'll show up as headaches and tension in your jaw. When you're looking at other people, sometimes it shows up as changes, almost like changes in personality. So your really outgoing kid is no longer your outgoing kid. They're
I've seen that.
Mhm.
Okay.
Yeah. Or your spouse, normally if they're really easygoing, and then they're really stressed out about money, sometimes that they get really angry really fast, or their tempers flare up. So the main thing to look out for is kind of a shift or a change in what they were doing before, and vice versa. If you're an introvert, sometimes people expect you to be really quiet. So when those people start being more outgoing, I wouldn't say it's a cause for concern, but it's something to keep an eye on. So yeah, so it goes both ways.
What about sleep habits? I find I'm having difficulty sleeping, and it's really not an easy thing for me. Typically, it hasn't been since I was diagnosed with cancer, frankly, but it has gotten extremely difficult now. Is that a sign of perhaps what's the stress I'm experiencing?
It is. So the one way to think about it is that the unresolved stuff from the day, if it's not resolved by the end of the day, your brain is going to be working on that stuff at nighttime. And so, yes, absolutely. If there's unresolved stress or you have thoughts, it can show up as nightmares. It can show up as really vivid dreams, or just difficulty falling or staying asleep.
Changing dreams. Okay. I wasn't aware of that, and I have experienced that. The other thing I wanted to talk about with you, and that was a great explanation, because I think sometimes we're so busy just trying to cope ourselves that we might miss those signs and symptoms in others, and that can end up manifesting in some really bad ways. And we've got these poor parents trying to teach at home. I was about to say it could happen at school, but we're all homeschooling now. That is the norm, and that's adding to some of what we're feeling and what we're trying to deal with, which is why this conversation is so important. The other thing that I wanted to talk about that really ties in with Drop the Drugs. And, I founded this organization about a year ago as a community awareness campaign, and it has evolved into a full-scale 501c3. We're going out into the community and providing substance abuse awareness education. We're talking to people, giving them our handy infographics. We have them in English and Spanish that talk about safe ways to store drugs in the home, safe ways to dispose of drugs, and to keep an inventory of drugs. For example, some people are looking over my shoulder thinking, that's not very safe, because I'm trying to give an example of what so many of us do that we shouldn't be doing. And next to this, I have my box cutter. Now, no one would leave this lying around on a kitchen counter, on a nightstand, or in a medicine cabinet because it's dangerous. They're worried about kids getting harmed. I want people to start thinking about their prescription and over-the-counter drugs just like this. It can be just that dangerous. And additionally, when we leave them around where anybody can grab them, as you know, we increase accessibility. So anybody troubled, curious with addictive behavior can easily, they might not even take the whole bottle, just take some pills, which I think has happened to me. I'm like, I thought I had more back pills, but I don't know, maybe I took 2 one day and didn't remember. So in regards to people who might be abusing drugs or curious about drugs, what are some signs that we might see beyond the stress to tie in with, because in America, we tend to go for drugs, whether it's oxy or caffeine or cigarettes or, we're all guilty. What are some of the signs of drug abuse, self-medication, warning signs that we might see?
Yeah, one way to think about it is coping skills, right? So when you're already stressed out, a coping skill is something that you use to deal with your stress. And if you're already stressed out going into COVID-19 and this whole quarantine thing, you're going to be even more stressed. And so a lot of people, if you're using drugs, if you're drinking, you have a tendency to do more. You smoke more because you're nervous. You drink more because you're nervous. You start to take more of your pain pills. And it, depending on the substance, will determine what the intoxication looks like. So sometimes it's slurring your words. Sometimes it's being very, have a change in consciousness, meaning you don't respond to stuff as quickly as you normally do. Other times, like if you're drinking a lot of caffeine or smoking a lot of cigarettes or doing any kind of stimulant, cocaine, Adderall, that sort of thing, you'll be moving a lot faster, sweating, talking really fast. Some people can actually start to see things and hear things that aren't really there. Yeah, so the key is to pay attention to what substances you're using, and then if you know somebody uses around you, keep an eye on them. It's not only a nice thing to do; it's a safe thing to do.
Right. As you talk about that, it also makes me think about eating. I've been having a lot of chats and happy hours with my girlfriends, and we're all talking about how we're just grabbing stuff, if it's salty, if it's crunchy, and it gives me a temporary type of high feeling of something sugary. Fried foods, does that also fall into an addictive type of pattern?
It does. It all releases dopamine. Chocolate, all these things release a little bit of dopamine, which feels really good. But unfortunately, sometimes feeling good is not good for your body.
Right. Got it. Understood. One of the things I want to talk about as well, from our perspective of public education and awareness, is that we also want to caution people, in addition to safe storage of drugs, you need to look at your drugs. They have an expiration date on the label. So many people don't realize that. They get some pills and by golly, they're going to hang on to until the label is coming off by itself. But they have an expiration date, and it can be dangerous to just hang on to those, to have them around. You're not going to notice if someone takes them. as well. And also they're subject to misuse and the temptation to abuse them. So find the ones that are expired, ones that are unused, especially those dangerous pain pills, and dispose of them. Normally we have take back day that got canceled this year because of coronavirus. So I'm gonna say just hang on to them until those free disposal drop-off locations are available, but get them out of sight and out of mind. It may be a lock box, it might be a toolbox. It's going to be inconvenient, but you know what, safety can be inconvenient. It's inconvenient for me to stay home right now all the time and have to cook, but at the cost of millions of teens. It's stress. April is Stress Awareness Month. That's how this came up. And 3 out of 5 teens who become addicted to drugs say they started with their parents and their grandparents' drugs. So we need to go ahead and have some inconvenience and not feel comfortable about this, because we've got some dangers we're worried about outside the home. We've got our mask and our gloves, but there's still some hidden dangers in the home that we want to make people aware of. And so to our next thing, what are some signs of abuse in teens and adults? We talked about that, the slurring. What are some things that you're seeing in your practice that are common problems people are coming to you with, and questions that they're asking?
Yeah, so lots of different areas. Most folks are just stressed out about wanting to get back to work. Work gives us a sense of purpose and a sense of being. And so a lot of people kind of feel kind of just like they're being tossed in the wind because they can't get to work and get their hands on their work. One question that I'm asked a lot, and it made me think of it just now when you were talking about expiration date and extra medicine, is that people have been asking for extra medicine. They were worried about about there being a shortage. And the problem with that is that if there isn't a shortage, then you just have extra medicine laying around, which means that it's even more important that you lock stuff up. From what I've been seeing and hearing, we're not supposed to have a shortage. So please just, if your doctor gives you an allotment, keep it safe, take it as directed. And then just a lot of people are just worried. We don't have a very consistent message of where this whole thing is going. And so if you don't have a consistent message, people fill in where they think the gaps are. And then that turns into kind of drama and confusion and anxiety. And
Absolutely. As you say that, I was thinking I saw an article today about Whoopi Goldberg, the comedian and longtime host of The View. She decided to work from home. She's had some health challenges recently. I don't get to watch it because I'm working all day like you, but I kind of keep up with it on YouTube or whatever. And she said that they're in New York, they've got the mayor saying one thing and the governor saying another thing. That's the other thing, just the overwhelming amounts of, of press conferences and data and the really alarming statistics globally with this pandemic and the healthcare workers. But Whoopi said that she decided on her own, even though her doctor said, well, you can go, you're okay. She decided on her own until we get a consistent message that I feel comfortable with. And I feel like I'm going out in space when I go outside. It's just scary to go out now, and I don't recall ever feeling like this before. It may be what people feel like when they're in a war, but that's kind of what comes to mind for me. Another thing I ran across, I mentioned to you last night, I did not know about this, and I'm going to have to put my glasses on and then I'm going to throw it back to you, but I really want parents to know this. You've got those teens at home, right? And you're ready for them to go and they're ready to leave. Trust me, I have 2 adult sons, but one of the things, they're very, very curious, and teens between 13 and 16, a lot of times they're just experimenting and looking for a cheap high. So some of the conversation we want to have with them, because they might be trying to cope in other ways, is to be careful when we're fraternizing again, when they go to parties, about edibles. There are a lot of ingredients being put into edibles. My mom used to tell me, we're not eating other people's food. I could be starving, but if they said, are you hungry? No, ma'am, thank you, I'm fine. Hadn't eaten all day long, but my stomach growling. I'm just fine. But really, they need to be cautious about, I mean, girls, we pretty much know, don't put your drink down, don't leave it. But everybody, we got to really be more careful about that. And here, the DEA is so common now for teens to get drugs and then, of course, have to hide them, that I got this on the recoveryvillage.com about teen addiction, but the DEA has info about where parents should look for drugs hidden in their teens' home. This was just crazy to me. Alarm clocks, shoes, game consoles, personal hygiene containers, toothbrush holders, calculators, lip balm containers, and then they have, and this is no reflection on the makers of this wonderful product, which happens to be my favorite and the only type of this beverage that I drink, but they have stash cans, folks. They can take the bottom, it's got a false bottom on it, and put drugs in it. So if you have good reason to be suspicious and you see a can that's just been sitting there way too long, even for a kid that doesn't like to clean up, I mean, these are the types of things we just have to be aware of. I personally would rather be a little bit suspicious when I see changes in behavior, changes in friends, than to not intervene and have a tragedy occur. Hairspray cans, water bottles, we just got to be really, really vigilant about what's going on with our kids and talk about these things. But I'm going on about that. I want you to tell us some more about coping, some healthy ways to do it. I keep hearing about walking, which I'm doing, and cooking. And I've got an Instant Pot, so there's not a whole lot to that. You just throw everything in and put it on 8 minutes. But what are some other things you'd suggest?
Yeah, so there's an infinite number of coping skills. Like there's so many you can't even count them. And so, but one coping skill is mindfulness. So mindfulness is all about basically staying in the moment. And if you think about it, one of the hard parts about being in this crisis is that we don't know when it's going to end. And so instead of looking, a month or 2 months, it's very much being in the moment. I am present. I am here. I will not judge the moment. I'm just here. So that's one approach. And then from mindfulness, there's meditation. I'm a doer. So, and I know I like to move and shake. So I've been working on a new business plan. I like cooking. So if you cook, cooking is very, it's a finite activity. You start with something, you make something, and by the end, you go, oh, I did something big. Journaling, singing, dancing, having a dance party. I mean, be creative. And when in doubt, just Google what to do when I'm bored, and that'll be a great coping skill.
And someone will have a YouTube video of it. There'll be a Twitter, a whole page named after it, Instagram. That's funny because I actually posted a video today of me doing my trash down dance. I was coming back from just putting the trash out, and I started dancing right on the patio because I was so happy, like I was on furlough. And I was dancing and Ring caught it. And, that happens sometimes. I usually have a house coat on. So I was like, but today I was actually dressed for company. So I posted it, but it gave me those endorphins for about an hour or two because it was just a happy moment. I was outside. I saw a couple of neighbors. So you're right. It doesn't have to be a big thing. And if you see me glancing off, it's not that I'm not being mindful. If you guys can hear us and you're getting some good information, give us a thumbs up and hit that wow face for us. But that's what I'm doing. I'm checking out the Facebook stream. I'm looking at the comments, but I am very in tune to what you're saying here and really, really enjoying it. We didn't discuss this beforehand, but it's on your website. I've heard you talk about it in terms of stress. My story is 2-time cancer survivor. And this is hard. I'm going to say that was as hard because of the, possibility of losing my life. And I thank God that I didn't. But you had circumstance, you called it burnout. Can you share that with us? As a physician, that was really interesting to me that you'd be that transparent.
Mm-hmm. Yeah, it's really in my history. So I grew up super poor, food stamps, the whole 9 yards. And so I've never forgotten that. And I always tell people, so poverty is stressful, like it's deadly. therapy. And so, for what it's worth, let me just say we should pay Black people more, but we'll get to that on a different podcast. When it comes to burnout, yeah, so I was trained in a system where I thought that I could do what was best for my patients. And unfortunately, there's lots of players in the market that come between me and my patients that then dictated what I could and could not do. Well, you can't do that therapy, or, oh, you need to write things this way, or you can't get paid until you click 12 boxes to get to where you're going. And it just got overwhelming to the point where I said, I don't want to do this anymore. But when you're, $150,000 in debt and don't have any other useful skills, you got to do something, right? So I said, no, I love seeing patients. I'm going to stay in the game. I just need to switch up what I'm doing. And so that's why I started my own business, and I've been doing it for the last 6 years.
Well, congratulations to you. That is wonderful. And I haven't met a lot of African-American psychiatrists. And I know there are a lot of males, but I still get people. I've been a dentist 32 years, and I still get people saying to me, oh, I've never had a Black dentist. I've never seen a Black dentist, like we're a unicorn or something. So, I know some of the challenges you had to go through to get that terminal degree. And I relate to what you're saying because my nerves, even just trying to get into dental school, because I had gone through, 12 years of high school. And I decided in the 10th grade to be a dentist and put everything into that. And then, Baylor. And I'm like, I don't know how to do anything else. Yeah. If this doesn't work out, I just spent 20 years learning how to do one thing and then to be disappointed by it. I can imagine that was very sobering for you. So I'm glad that you shared that and how you handle it and that you stayed in practice. I want to give a shout out to the city of Grand Prairie. Mayor Ron Jensen, our city council, Deputy Chief Steve Dye, Council Member Georgia Clemson, the whole police department, all of them, they've been really supportive of this organization, Drop the Drugs. I'm Dr. Mo Anderson, founder and president of Drop the Drugs. We've got Dr. Brian Dixon, a psychiatrist, licensed practicing, and we're talking about stress, drugs, and stay at home. If you're just joining us, thank you. And this is a really important conversation that needs to be had right now. You could be off with D-Nice dancing or doing some other things, but we've got to get serious for a moment and prepare for life after COVID, right? Is there going to be life after COVID, Dr. Dixon?
Absolutely. There will be life after COVID. And so building good habits now means that you're going to be ahead of the game later on. So there's research that says that approaching 40% of adult Americans are obese. I think 1 in 5 or 1 in 6 have a mental health diagnosis. We have lots of folks who are abusing drugs and alcohol. Let's start now working on better habits so that when this thing is over with, and it will be over at some point, we can come out a better people.
Oh, I like that. I like that. And you made me think about, as you were talking about that, just a couple of more stats I wanted to throw out there. One is that this is actually just information. I don't watch Sesame Street anymore. I used to. I love it. Cried when Jim Henson passed away. But did you know that now on Sesame Street, I'm reading from Drop the Drugs' last press release that was called "The War on Opioids Now Includes Toddlers and Teens." And I learned in doing research to write this press release that Carly, a character on the Muppets, has a foster mother who is an addict. I mean, we're having to teach this to toddlers now because it's so common. When I was a kid, that would have been unheard of. In fact, Lucy and Dizzy Arnaz couldn't even sleep in the same bed on I Love Lucy. That's how far we've come in my lifetime. And now these kids have to deal with this, and they're away from their friends. So not only might they be trying to cope with that by going after the prescription drugs, but over-the-counter drugs that you guys don't even think about, that you might call candy, cough medicines taken in high enough doses. I learned this, can be very potent, cause a hallucinogenic effect. Cough medicines, cold medicines, that's why we have to show our identification now. Motion sickness pills that you might have gotten for a cruise or whatever can cause psychedelic properties taken in high dosages or by a young kid. And this one blew me away. 15% of kids in rehab used mouthwash to get high. Mouthwash, the alcohol content in there, it might not be enough to sanitize our hands, but actually they used to tell us not to use it all the time when we were practicing, like between patients, because many dentists in the past had become alcoholics unintentionally just before they wore masks, trying to have fresh breath. So, it's not always that we're trying. I mean, we're not putting any shade on addicts. If you go on dropthedrugs.org website, please like our page, check us out on Twitter, Drop the Drugs USA, but we're more comprehensive on the website, dropthedrugs.org, and there are blogs about all of these subjects. There's recovery and addiction resources, which are really important because we want to help people. We're not trying to label, not trying to judge. Like I said, I threw myself under the bus for caffeine because I have to have it in the morning. I am addicted to it. In fact, the last surgery, they told me to go ahead and have some sips of coffee, even though it's not a clear liquid, because they didn't want it to change my response, my behavior, because I was addicted to it. I was like, wow, well, I appreciate y'all recognizing me. I was going to do it anyway, but I was happy that they gave me permission to do so. But, as we learn as healthcare providers, then we adapt to the evidence. So I wanted to make sure people understand that it's not just, lock up your prescription meds, but there's also abuse of over-the-counter substances, stimulants like ADHD. Parents, you need to have an inventory of that. Don't just give them a bottle and tell them, okay, I'll let you tell that one because you're really nodding now.
Oh yeah, absolutely. You should know exactly when your kids are taking their medicine. And if you suspect anything, you can even check the cheeks and make them lift their tongue to make sure that they're taking their medicine as directed. Because I've seen way more kids than you believe divert their medicine, cheek it, and then they take it later on and sell it or take it all at once. Yeah, I've seen every variation on the theme. Yep.
Okay, let me rewind. Let me understand that again. So you're standing there. You need to be administering the drug to them, even if it's a teen or whatever, and which we promote. So I'm glad to hear you co-signing, so that you're making sure that they're taking it properly at the right time, but also so that they're not, when you say cheating it. So what we're looking for is to make sure, kind of like we see in the movies on television when they tell them to stick out their tongue if somebody's in an institution.
Yeah, you're correct, because even if your kiddo isn't getting high from that medicine, some people will save their medicine and take it all at once. And most ADHD medicines are designed to keep you from getting high or being able to. The problem is they have street value. So they would take it and give it to somebody else or sell it to somebody else, get the money, go buy their weed, right? So just be very, very mindful about all those things. Make sure they're taking their medicine, count those pills, right. And then you'll know if they're not taking their medicine because those grades will start dropping and you can be like, wait a minute, something's not adding up.
Yeah, I didn't think too much about it until I started treating children exclusively at one point, and I could almost tell which ones were or were not, from looking at their chart. It was pretty amazing to me because I grew up with everybody just needs a spanking. That was behavior management with me. And now I realize that was abusive to some people who were neurotypical or, needed some type of pharmacological intervention. But, that's what we grew up with. So we've got some questions here for you. If you guys can hear us, D'Amica, Renita, Aaron, thanks for joining. Hey, Mom, give me a thumbs up, hit that like button, give me a wow face. We've got, we needed this so much, good information. Here we go from Aaron. How important is it, Dr. Dixon, to have a routine for yourself and your family during this time to help people stay away from picking up these bad habits? Good question.
A plan is everything, y'all. It is everything. So, here it is. This is my plan. Like every day I get up and I follow my routine. Okay. I have my to-do list every day. You can't make six figures if you don't have a plan, y'all. You have to have a plan, right? You wake up at the same time every day. I do my best to try to plan out my meals, right? So I want to go and buy, you don't need to buy a whole month's worth of food. That's a bit much. You buy for a couple weeks. You then portion it out, because we overeat. We all tend to overeat, right? So we want to eat right, have an activity that you do that day. And the other part is, if you don't want to do anything, plan that too. You know what? I'm going to take 2 hours and not do nothing. I'm going to sleep on the couch. I'm going to read a book, and then try to go to bed at the same time, and limit your alcohol intake. So yeah, a plan for me is what actually gets me through all of this, so that I don't get, frazzled and be all over the place.
Right, right. I feel you on that. And I am a planner. We can't really do what we do without it. I mean, I start out the year with my vision board, with my big, hairy goals. And then I've got, I mean, if you can see my office right now, I'm crazy about the list. I'm old school like you too. I have to write it down and fill the paper and then cross it out, baby. Yep. I did that. And I used to not be able to go to bed if I didn't cross everything off my list, but I'm old now. I got over that. But if I get that top 3 crossed off, I can live with that. I'm happy about that. One other thing we want to talk about with these very important topics regarding stress and self-medication, potential poisoning and abuse, is that when you're getting rid of drugs, this is where they don't go. Like I said, that's my trash can. Just hang on to them until you can go to the hospitals, police departments, and pharmacies, Walgreens and CVS, that participate in the free take back program year round that's going on. It's not just twice a year. They promote it real heavily twice a year, DEA take back day, but year round for free. You can go to these locations, no ID, it's completely anonymous, no charge, and dispose of unused expired prescription drugs. Get them out of the home, away from you, away from your children, so that our homes are really safe spaces and we don't have these hidden dangers, whether it's pesticides or drugs or whatever. We have to continue to be vigilant, even when they're teens. Even when they're teens, you can get, like I said, digital lock boxes. You can just hide them in your closet. You can put them in a purse that they don't know about. You hide Christmas gifts. You hide stuff you don't want your spouse to see. You know how to hide. And then just get Alexa or put something in your phone to remind you to take your pills, So let's see if we have any other questions. Thank you guys for joining. The stringers, my neighbors. Over-the-counter meds can be dangerous. We've got a great group watching here. You guys, please share this to your pages. Let other people know this conversation is going on. Give us a thumbs up and a heart, because we're working hard here. Me and Dr. Dixon are collaborating. You are just a really, really awesome guy. I want to share some other things here from the research we've gotten about over-the-counter drugs, because there's just so much there, and they are just all over the house. Nobody's even thinking about it. Taken alone or in combination with alcohol, drugs like I mentioned before, the cough medicines, but also acetaminophen, diet pills, and motion sickness pills do more than make you high. They can cause liver failure, seizures, strokes, heart attacks, and death as potential consequences. This is not something in a brown bottle. This is acetaminophen in your family's kitchen, in the bathroom. Everybody just goes in there and grabs a couple whenever they feel like they have a headache, which may be some of the stress that we're talking about, which is where the self-medication comes in. You're not really dealing with the problem, right? We're masking symptoms with these drugs, and maybe need to have a little more conversation, some more of that exercise that you talked about. Have you seen any of this in your practice? Have you seen anyone abuse drugs to the, and obviously HIP and all that, I'm not looking for names, but to the point that they actually had physical harm or had to be hospitalized?
Oh yeah, so I've seen it more times than I can count. Sometimes it's intentional. So if they're depressed and they have what we call a primary, so meaning they come in and they have depression or anxiety first, and then they use substances to try to deal with that, and they overdo it, or they try to end their life. So I've seen it from that direction. I've also seen it from the other direction. They like the way that the drugs make them feel. They like the way that drinking makes them feel. They had that hip surgery and got those Percocets, and liked the way that the Percocet kept them from feeling pain, right? And
Right.
then it snowballs from there. So yeah, I've seen both ends of it. It's really, really tough. A lot of drugs, both street drugs as well as the prescription drugs, create what we call psychological and physiological dependence. So psychological meaning you start to feel like you need it. And then physiological meaning that your body says, oh my gosh, if it's not here, I'm gonna have issues. And so it's really tough for folks who are addicted or dependent. Yeah, I'm with you. We're not here to shame. We're here to get you help. And one way to get you help is to decrease the chance that that stuff is around. You have got to discard of it properly. And when you have it, use it wisely and do your best to wean off of that stuff safely with a doctor.
Right, right. Oxy has become kind of the poster child for the new war on drugs, and we know that it relaxes your body and decreases your perception of pain. And quite honestly, who wouldn't want that right now? But there's such a price to pay with the addiction, with the impact on you financially, economically, personally, simply by overdoing it, misusing it, self-medicating, abusing. We've also got elderly people. I think I saw my friend Nikki Calton online. Nikki works pre-planning funerals, and one of the things that we've talked about, and one of the things I've heard a lot of people say in regards to our campaign, is that they have senior members of the family or just whomever who are in hospice, who are sick for a long time, and they have so many drugs and they don't know what to do with them. And sometimes they just leave them wherever they were because they don't want to deal with it. But that's a big potential for abuse. So I want to remind people to be aware of that as well, and that there are, as I said again, places to dispose of those. There are just so many ways that drugs have. We've seen the rates of addiction rise, and as the opioid rates have risen, we've seen the confinement, the jails, the arrest time rising, not necessarily in a way that seems fair or equitable. And then we've seen the hospitalization and the emergency room all rising together in addition to the poisoning and so forth. And it's just an alarming trend. But right now, let's get back to what's going on with this pandemic. And we're seeing the numbers of infection go up, the numbers of deaths go up. Our mayor, Ron Jensen, who I mentioned earlier, just said we had over 100 right here. And I live in a small area in Grand Prairie. We have over 100 deaths. And my accountant told me yesterday he's lost 2 friends directly to coronavirus right here in the Dallas-Fort Worth area. And now we're talking about opening up and going back home, even though all of this is still going on. Just how do you prepare yourself for that? I mean, some people, I work from home, but some people won't have an option. The boss is going to say, we're open for business, let's come back, even though we see death and infection all around us.
Yeah, so I would say 2 things. First is know the facts. And so I'm going to run you through the facts as I understand them. And then the second part is plan. And that first P, that is the P of plan, I always say is your precaution. So I'll run through that quickly as well. So going backwards for just a second. So the virus, this coronavirus is a virus, just like a cold virus or an influenza virus. They're actually all part of the same family. They have a common chassis, meaning they're all built in the same way. The difference is we're not used to it. And so since we haven't seen it before, our bodies don't know how to make antibodies to it. And so that's why it causes us issues. The key thing is the P, meaning the precautions. So if you take control of what you're doing and you be thoughtful about what you are doing, you're going to decrease your risk. And that means stay 6 feet away from folks, wear a mask if you go out, wash your hands. Washing your hands is better than hand sanitizer because the soap, the way that soap works, it actually breaks down the viral capsule. Hand sanitizer, again, is a nice alternative, but wash your hands for 20 seconds. If you do those things, the virus, as we know it right now, doesn't really linger in the outside air very much. Now, if you're in an enclosed space and somebody's coughing, maybe, but most people aren't in an enclosed space with a person who is actively sick. So I like to give people the facts so that they don't get too fearful. Just make sure you're doing your part, and the risk of you getting sick is going to be much lower.
And information is always power. And I'm big on hand washing. You know, we take classes in hand washing so that we can do surgical procedures. But I tell you what, I had lapsed a little bit, but I have gone through more soap. I'm refilling soap dispensers and bars of soap. And my sister got me this for, you know, those times, because I've always, this just drives me out. I don't want to be using this all the time is the other thing. And I mean, while we're on it, just talking about healthcare, you know, some people, when they were saying don't wear gloves, and this is an aside, it's not on our, you know, topics, but some people were like, you know, that misinformation that's leading to the stress. I've been wearing a mask since February because I'm high risk, and I saw what was going on overseas a month before they thought about closing down here, because I'm just an information junkie. But also I was sharing with my family members, look, you get cracks in your cuticles. You have different abrasions on your hands. You can get infections through your hands. A lot of dentists get staph infections from being in the mouth. So this is just me. And I don't know what Dr. Fauci said, but I wore gloves for the over 2 decades that I was in practice, and I wore masks, and there was a reason. And I know that they protected me because we are just right up in there, you know, which is why dental offices are closed right now, because that aerosol lies, that speeding aerosol puts us in the 99th percentile rate for possibly getting, you know, contracting the disease. That's why dentists aren't working. It's not that they aren't essential. It's just that it's extremely dangerous. Well, this has been a great conversation. I'm going to get a couple of more questions in here, and then we'll wrap it up. Dr. Dixon, Dr. Brian Dixon, joining us from the Dallas-Fort Worth area. He's a psychiatrist. He is in practice. You can find him online at Dr. Brian, BRIAN, Dixon.com. You can Drop the Drugs Facebook page while you're here, and you can visit us at dropthedrugs.org. And I did see a question. Here we go. D'Amica wants to know, what is one thing we can do to help mitigate unnecessary drug use? That's a great question, with our young family and friends. Yeah, other than, I assume she's meaning other than what I'm saying, the securing it and disposing of it, because they can get drugs other places, obviously.
Yeah, so use it responsibly. If whatever it says on the bottle, so if they say take that antibiotic, you know, for 14 days, go ahead and take it for 14 days unless you have a side effect, and let your doctor know, right? And then if you don't need it anymore, dispose of it. So I have a whole spiel, I have a whole speech about diet, exercise, and sleep to keep you healthy, so you don't need medicines in the first place. But yeah, one of the main things to do is, if you get a medicine, take it as directed. And if you don't need it or don't want it, dispose of it correctly.
Oh, that's a great point. I've also had so many people self-diagnose and take, say, some old antibiotics that they had because they decided that they knew they had an infection, and then they come in with a fungal thing all over their mouth because they've killed all their good bacteria because they didn't have an infection, a bacterial infection, they had a virus. So that's the other thing that's mitigated when we get rid of these drugs. It makes you go in to see a healthcare provider and find out, assuming that you're able to, because you're the expert on healthcare and healthcare reform. You guys have to check out his website. He's got a book out. I'm not going to say the title of it because I think they'll stop being mindful if I do, but it is a great title, a great book, available on Amazon, but you can go on Dr. Dixon's website and hear it. But again, see your healthcare professionals. You've got oral healthcare, you've got physicians for the rest of your body, and then we've got folks like Dr. Dixon for our very important mental and emotional well-being. Is there anything more you want to share with us before you go, Dr. Dixon? It's been a pleasure.
Yeah. I love telling people this one line: you are a terrible therapist for yourself, because everybody is too close to themselves to be objective and to be able to step outside ourselves and go, wait a minute, that ain't, what am I doing, right? And so, yeah, in a time like this, if you're feeling overwhelmed, reach out to somebody. There are lots of therapists. There are Black therapists, white therapists, gay, straight, every therapist of every type that are in private practice, or they're working for local hospital systems. They want to help you. Just reach out. So please don't stay at home and suffer in silence. Reach out and get rid of those extra medicines.
Absolutely. We get help for every other area of our body. Our brain, our mind is another area that needs attention. And thank you for that final word. You guys, thank you for joining us on our first Facebook Live webinar. We did that via Zoom. Thank you, Zoom. Thank you, Jay Chase, for helping us work out the technical difficulties for 3 hours last night. My sister, God bless her. And you guys do visit us at dropthedrugs.org, and please like our Facebook page so you get more up-to-date information on how you can keep your family healthy and safe. You guys have a great night. Thank you so much.